The day of the procedure, we spend a significant amount of time on getting the patient comfortable for the procedure. We'll put some sprays, some cotton pledgets soaked in the numbing medication into the nose, and that takes about 20 or 30 minutes to set up for their nose to be really adequately anesthetized. By now, we're in the procedure room, we're getting ready to start the procedure, and we're going to start by using a special sinus balloon to access the natural drainage pathways, and we confirm the proper placement of the balloon within the sinuses with our state-of-the-art in-office image navigation system. The procedure itself takes about 20 or 30 minutes for me to technically perform all of that, and then we'll observe the patient for another 10, 15, 20 minutes, as long as it takes. We'll move them to one of our exam rooms, and we'll just keep an eye on them, just make sure everything's okay before they're ready to roll. Almost by its nature, we've been able to inflate this balloon across what we call the ostium, the drainage pathway of the sinus, and I've seen that balloon with my eye visually expand, then I know the sinus is open, because I've also confirmed the fact that the balloon was in the right place with my image navigation system. Patients are going to expect a couple days of some oozing, tenderness, congestion, pressure, and any patient having a nasal procedure, we'd say, don't blow your nose, sneeze with the mouth open, no heavy lifting or straining. Typically, Motrin and an ice pack over the facial region is going to be enough to adequately control their pain.